After recommending that people call the Department of Health with questions and concerns, how are you guys adjusting to field some of those calls?
So we're getting a number of calls related to our press conference today, and depending on the volume over the weekend, we may establish a call center on Monday if the calls persist. But currently now, because we're getting calls, the State Department of Health is getting calls, and I'm sure our mayor's office is getting calls, and the governor's office is getting calls. So far, we're able to handle the demand.
Your guys' office, you guys have been putting out there, these are the precautions people need to take. What are some of those precautions that people should take in order to kind of prevent from getting either COVID-19 or even the flu, because I know that's been a big issue this year?
So the biggest thing and the most important thing that any resident can do to protect themselves is to wash their hands with soap and water for at least 20 seconds, and if that's not available, then to use a alcohol-based sanitizer, and that means your sanitizer has to have at least 60% alcohol or higher. The second most important thing is cover your mouth if you're coughing or sneezing, and we prefer that you don't cover it with your hands, but maybe along your sleeves. And thirdly, that's really critical, we want to see if we can have people stop shaking hands now. No hugging or no kissing in this particular season. So I think those are all good tips. And never forget, if you, from a nutrition standpoint, you're eating healthy, you're getting the exercise that you need and plenty of sleep, then you're less vulnerable to getting a viral illness such as the flu, or even be susceptible to this new strain of the coronavirus.
And do you think these precautions that are being taken for both the flu and the coronavirus, do they kind of go hand in hand in a way?
So they definitely go hand in hand, because we actually have way more flu cases with significant morbidity and mortality associated with the flu than we're seeing so far with this coronavirus. So it's protected of both those particular viral infections, which can have complications where they're life-threatening.
One thing that you guys even mentioned this morning, for people not to panic with the coronavirus, because really right now I know the flu is a big issue.
Right.
87 people have died. So kind of talk about that a little bit, the concern.
So we want you to be concerned about the coronavirus strain, but influenza or the flu is much more deadly, and we're having way more illnesses related to the flu and a higher rate of hospitalizations and complications to the flu. So I don't want us to take our eye out the ball related to the flu and how serious it is, but we need you to do the right thing to protect yourself, but also protect your loved ones, protect your colleagues and your friends by just being able to have a healthy behavioral lifestyle by frequently washing your hands. I need you in your homes or your environment where you're residing to clean with disinfectants, with good household products. Make sure you frequently clean things that you touch frequently.
What are some things that you're finding out that Hoosiers kind of do well already? Thinking a bit more positive here.
So I think that one of the things that we really do well is that we have fantastic healthcare systems. So we have some wonderful hospitals, great doctors. We have what I think a very strong state Department of Health and a local public health department. And what we do so great is we do a great job of communicating among ourselves and a lot of coordination. And we practice. And so we've had a lot of experience in the past, whether it's with H1N1 or the Ebola virus. We know how to prepare and be prepared for events such of this nature.
Okay, and one final thing. I know you were saying don't shake hands. Instead you guys are calling it the Indy
Yes,
bump,
it's
right?
the Indy bump.
How are you, so can you kind of tell people exactly how to do that?
So I want you to put your elbow out there, and if you want to acknowledge somebody, you want to greet somebody, just elbow to elbow, okay?
Absolutely. Anything else that we missed? Anything else you want to add? Anything else people need to know?
I just think that if anyone gets ill, if you think you're having a fever or shortness of breath or coughing or sneezing, make sure you see a healthcare professional, but call ahead. Don't just end up and knock on the door of your private healthcare professional. Just don't end up in the emergency room. Call ahead because we don't want to have to contaminate anybody in the waiting room. And so we have special preparation for you and how to do an evaluation assessment without worrying that we're infecting anybody else. So call ahead.